Thank you. Our witness today is Dr. Anthony Fauci. Dr. Fauci was the director of the National Institute of Allergy and Infectious Diseases from 1984 to 2022 and chief medical advisor to President Joe Biden from 2021 to 2022. Pursuant to Committee on Oversight and Accountability Rule 9G, the witness will please stand and raise his right hand. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Let the record show that the witness answered in the affirmative. The Select Subcommittee certainly appreciates you for being here today, and we look forward to your testimony. Let me remind the witness that we have read your written statement, and it will appear in full in the hearing record. As requested, please limit your oral statement to 6 minutes. As a reminder, please press the button on the microphone in front of you so that it is on and the members can hear you. When you begin to speak, the light in front of you will turn green. After 5 minutes, the light will turn yellow, and when the red light comes on, your 6 minutes has expired, and we would ask that you please wrap up. I now recognize Dr. Fauci to give an opening statement.
Mr. Chairman, Ranking Member Ruiz, members of the subcommittee, thank you for this opportunity to testify. Prior to my retirement from federal service in December 2022, I had been at the NIH for 54 years and director of NIAID for more than 38 years. In those posts, I was deeply involved in the scientific and public health response to several infectious diseases outbreaks, including HIV/AIDS, pandemic flu, Ebola, and Zika. And so, under my leadership, we were well positioned to respond to COVID-19. For at least 2 decades prior to the COVID outbreak, we at NIAID had invested billions of dollars in research on mRNA technology and immunogen design, both of which led to the swift development of COVID vaccines. Less than 11 months after the identification of this new virus, safe and highly effective vaccines were widely available, an unprecedented accomplishment in the history of vaccinology that saved tens of millions of lives worldwide. I will now use my remaining time to directly address certain issues that have been seriously distorted concerning me. The first issue concerns my actions regarding the possibility that SARS-CoV-2 might have resulted from a lab leak. On January 31st, 2020, I was informed through phone calls with Jeremy Farrar, then director of the Wellcome Trust in the UK, and then with Christian Anderson, a highly regarded scientist at Scripps Research Institute, that they and Eddie Holmes, a world-class evolutionary biologist from Australia, were concerned that the genomic sequence of SARS-CoV-2 suggested that the virus could have been manipulated in a lab. I participated in a conference call the next day with about a dozen international virologists to discuss this possibility versus a spillover from an animal reservoir. The discussion was lively, with arguments for both possibilities. 2 participants have testified before this subcommittee that I did not try to steer the discussion in any direction. It was decided that several participants would more carefully examine the genomic sequence. After this further examination, several who at first were concerned about lab manipulation became convinced that the virus was not deliberately manipulated. They concluded that the most likely scenario was a spillover from an animal reservoir, although they still kept an open mind. They appropriately published their opinion in the peer-reviewed literature. The accusation being circulated that I influenced these scientists to change their minds by bribing them with millions of dollars in grant money is absolutely false and simply preposterous. I had no input into the content of the published paper. The second issue is a false accusation that I tried to cover up the possibility that the virus originated from a lab. In fact, the truth is exactly the opposite. I now quote from an email that I sent to Professor Farrar on February 1, 2020, quote, "Jeremy, I just got off the phone with Christian Anderson, and he related to me his concern about the furin site mutation in the spike protein of the virus. I told him that as soon as possible, he and Eddie Holmes should get a group of evolutionary biologists together to carefully examine the data to determine if his concerns are validated, and they should report it to the appropriate authorities. I would imagine that in the USA, this would be the FBI, and in the UK, it would be MI5. In the meantime, I will alert my U.S. government official colleagues of my conversation with you and Christian and determine what further investigation they recommend. Let us stay in touch. Best regards, Tony," unquote. It is inconceivable that anyone who reads this email could conclude that I was trying to cover up the possibility of a lab leak. I have always kept an open mind to the different possibilities. Another issue is that of Dr. David Morans, who has the title of Senior Advisor to the NIAID Director, and who recently has been investigated for conduct unbecoming a government official. Naturally, given his title, a connection is made to me. With respect to his recent testimony before this subcommittee, I knew nothing of Dr. Morin's actions regarding Dr. Daszak, EcoHealth, or his emails. It is important to point out for the record that despite his title, and even though he was helpful to me in writing scientific papers, Dr. Morans was not an advisor to me on institute policy or other substantive issues. At NIAID, we had weekly executive committee meetings of the institute leadership and daily morning meetings of my immediate staff. And to the best of my recollection, he attended neither of these. Furthermore, his office is located in a different building from that of the NIAID director. Finally, in a majority staff memorandum of May 22nd, 2024, there is a statement, quote, "Dr. Fauci may have conducted official business via personal email," unquote. Let me state for the record that to the best of my knowledge, I have never conducted official business using my personal email. Thank you for listening. I would be happy to address these and any other issues in the discussion period.
Thank you. I now recognize myself for as much time as I may consume for questions, with equal time being afforded to the ranking member. Dr. Fauci, February 1, 2020, you were on a call with Dr. Farrar, Dr. Collins, and other scientists regarding the potential that COVID-19 was engineered. Was CDC Director Redfield on that call?
No, he was not.
Okay. Dr. Fauci, you've said that you had to rely on virologists and evolutionary biologists regarding origins because you're not an expert. Is Dr. Redfield a virologist?
I believe he is. Yeah.
He is. Prior to the pandemic, NIAID awarded at least 3 grants via the New York Blood Center to Dr. Zhao Yusen. Are you aware of these?
I'm sorry, to Dr.
Yusen Zhao? Are you aware of those grants? Dr. Yusen Zhao. Your microphone is not on, Doctor. Your microphone is not on.
I'm not familiar with that name.
Okay. Well, NIAID awarded at least 3 grants via the New York Blood Center to that scientist. He was a high-ranking Chinese PLA official and director of a lab at the Chinese Academy of Military Medical Sciences. Does it concern you if U.S. taxpayer dollars are funding someone like this?
Grants that are submitted to the NIAID go through a very extensive...
Does it concern you? I'm not talking about the process
Well,
right
I don't
now.
know
Does it
anything
concern you that that U.S. taxpayer dollars would be going to someone who's a high-ranking Chinese PLA official? Yes or no?
I would have to know more about that, Mr. Chairman,
Okay.
because I don't even
Well,
know
it
the
concerns
person
me.
you're talking about.
Are you or were you ever aware that the U.S. State Department in 2005 issued warnings that the Chinese government was working on the creation of bioweapons?
I was not aware of that.
Thank you. Did you ever discuss the Chinese bioweapons program with anyone in the intelligence community?
I've never discussed the Chinese bioweapons program, to my knowledge, with anybody.
Before, during, or after the COVID-19 pandemic, did you speak to the FBI, CIA, DIA, or any U.S. intelligence agency concerning viral research of any kind?
What time frame are you talking about, sir?
I said before, during, or after the COVID-19 pandemic. Did you speak to the FBI, CIA, DIA, or any U.S. intelligence agency concerning viral research of any kind?
I can't give you the specifics of it, but back in the time of the anthrax attacks, we certainly had a number of briefings of by agencies that were intelligence agencies. I don't remember who they were. It could have been any of the above that you mentioned, about the possibility that there were bioweapons that had fallen into the hands of bad actors, i.e. terrorists, that might have been used potentially as a bioterror attack. That was at a time when we had thought that the anthrax
So I
attacks...
appreciate that. I appreciate your expertise in that.
Well, that's the answer.
But did you at any time talk to concerning viral research of any kind?
Again, I say that at the time that there was concern about the fact that Al-Qaeda may have been using or potentially using bioweapons, we had discussions with intelligence agencies about that possibility.
But not as related to, say, COVID-19.
Not to my knowledge about COVID. Now, but let me just make sure we get the facts. After the investigations began about COVID, I was briefed by intelligence agencies about possibilities of there being activities going on in different laboratories. I was briefed by intelligence agencies.
Thank you. Science is always open to debate, and it's a benefit. The science supported restricting travel from certain countries at the beginning of the pandemic. And after these orders went into effect, the president was called racist and xenophobic. Dr. Fauci, you said in your transcribed interview that you supported those orders. Dr. Fauci, were those orders racist and xenophobic?
No, they were not.
Thank you. The vaccine saved millions of lives, and I want to thank you for your support and engagement on that. However, despite statements to the contrary, it did not stop transmission of the virus. Did the COVID vaccine stop transmission of the virus?
That is a complicated issue because in the beginning, the first iteration of the vaccines did have an effect, not 100%, not a high effect. They did prevent infection and subsequently, obviously, transmission. However, it's important to point out something that we did not know early on that became evident as the months went by, is that the durability of protection against infection and hence transmission was relatively limited, whereas the duration of protection against severe disease, hospitalization, and deaths was more prolonged. We did not know that in the beginning. In the beginning, it was felt that, in fact, it did prevent infection and thus transmission, but that was proven as time went by to not be a durable effect.
Yeah, definitely had a positive effect for many people, especially those that were vulnerable. But we knew from the trials that people that got vaccinated still were subject to getting COVID. So was the COVID vaccine 100% effective?
I don't believe any vaccine is 100% effective.
I now recognize the ranking member, Dr. Reeves from California, for 5 minutes of questions.